that is how we look at it. For him, looking at his issue, we have done a detailed evaluation looking for genetic abnormalities and antibodies against the complement system, like abnormalities in his cell metabolism, all those things. And we have ruled out other causes like infections and previous drug usage, all those things. And we have decided to go ahead with the transplantation. But thing is, like ABO compatible transplantation, like when the blood groups of the patient and the donor match, that is the ideal transplantation for a patient with thrombotic microangiopathy. And ideally it should be because there is a genetic component to the disease, even the donor should be evaluated for if family members, they can also have the same problem and they should also be evaluated before proceeding for transplantation. So when he came to us, only available donor was his elder sister, and she was not a blood group match. So even then, initially we evaluated for genetic abnormalities and then decided to go ahead, but ABO incompatible is an issue there. And one more aspect of ABO incompatible transplantation is ABO incompatible transplantation itself can cause this thrombotic microangiopathy if the antibody levels are very high. So this has added more complexity to the case. A case of thrombotic microangiopathy, which can have very high recurrence rates, depending on the genetic abnormality, it can go up to 90% post-transplant recurrence. And added to that, there was one more risk factor, that was ABO incompatible transplantation, that can again increase the risk manifold, and that can lead to loss of the graft. And it can sometimes be because of associated low platelet count and low hemoglobin, there can be a risk to the life also. So that is where we had a detailed discussion with patient and his attendants, and then we decided to go ahead. And again, we had to plan out the post-transplant management in case of recurrence. So, in case patient had post-transplant recurrence, the drug sir was talking about, it is called eculizumab. It is not available in India. Even if it is available, the estimated cost would be around 1.25 crores in the first year of transplantation, and subsequently that drug requires maintenance therapy. Like every year, it will cost around 75 lakhs. So that is where we had to come up with innovative ideas, and we had to plan it meticulously. And so these are some of the complexities associated with this transplantation. And regarding the ABO incompatible transplantation and how we did the transplantation, my colleague Dr. Naveen Kumar Medi will explain in detail about the procedure. But this was in brief about what were the complexities associated with this case. One, the pre-transplant evaluation itself is very complex, and recurrence post-transplant, the chance was very high, and added to that, ABO incompatible. So with this I'll conclude, and I request my colleague to take over.
Thank you, sir. Thank you for the introduction. So, respected seniors, Vice Chairman, dear colleagues and my dear friends and esteemed media members, a warm good afternoon to everyone. So first of all, I thank each one of you who have gathered here in spite of their busy schedule. And it's my privilege and honor to announce that the Department of Nephrology, Virinchi Hospital, has successfully performed a rare kidney transplant of ABO incompatible transplant in a patient of TMA with immediate post-transplant recurrence, managed effectively at low cost and with excellent graft outcome. One such a kind of transplant it is first in India and worldwide itself. So before going to our patient details, I would like to brief what is ABO incompatible transplant and what are the must points which we should know before knowing our patient details. So kidney is one among the most common organs to be transplanted in the human body. We do have other transplants like liver, skin, intestine, lungs, etc. Kidney is one such an organ, it is highly immunogenic. It means once it is a transplant, I will try to explain in Telugu as well. Once it is transplanted, our body performs antibodies, produces antibodies against the kidney which is transplanted, and it tries to reject the kidney. So for a good transplant or good acceptability, we should make the patient prepare for the transplant for good graft survival and better acceptability. So generally transplant is done in the same blood group. For example, A blood group ఉన్న patient కి A blood group ఉన్న donor నుంచే కిడ్నీ ఇస్తాం. Example A to A, B to B ఇలా జరుగుతుంది. బట్ కొన్ని సమయాల్లో డోనర్ దొరకనందున వేరే ఏమైనా ప్రాబ్లమ్స్ అవ్వడం వల్ల we will try to get a donor from other blood group. So this is called ABO incompatible transplant. So generally with the latest advances and the latest research and the latest drugs like rituximab, eculizumab, the different types of plasma exchange therapies, immunoadsorption therapies. So we have tried to make a success in ABO incompatible transplant. So approximately 2 to 3 lakh patients in India need transplant per year. But in India we perform approximately 6,000 to 8,000 transplants only in a year. So to combat this, in addition to live transplant, in addition to disease transplant, in addition to swab, ABO incompatible transplant alone itself can increase the donor pool to 25 to 30%. So overall results ఎలా ఉంటాయి ఈ transplant లో when compared to ABO compatible. So over time it can be either short term అయినా long term అయినా same. It is like same graft function and same patient survival when compared to ABO compatible. So patient preparation ఎలా ఉంటుంది ఈ పేషెంట్స్లో జనరల్లీ ట్రాన్స్ప్లాంట్ అనేది మేబీ 15 to 1 week ముందు రెడీ చేసి స్టార్ట్ చేస్తాం. బట్ ఇన్ దిస్ కైండ్ ఆఫ్ ట్రాన్స్ప్లాంట్స్ మన పేషెంట్ని 1 month నుంచి ముందే ప్రిపేర్ చేసి ట్రాన్స్ప్లాంట్ చేస్తాము. సో కాంప్లికేషన్స్ అదనంగా ఏమైనా ఉంటాయా ఈ టైప్ ఆఫ్ ట్రాన్స్ప్లాంట్స్లో? డెఫినెట్లీ ఇన్ దిస్ టైప్ ఆఫ్ ట్రాన్స్ప్లాంట్స్ వీ హ్యావ్ రిస్క్ ఆఫ్ ఇన్ఫెక్షన్స్ అండ్ రిస్క్ ఆఫ్ రిజెక్షన్, TMA, when compared to other normal transplants. But this can be prevented and managed very efficiently with the proper care. So knowing these complexities of ABOI transplant and the basic disease of TMA, which Dr. Naveen Matavada has already discussed. So TMA is a dreaded disease which has high risk of recurrence itself post-transplant. With a combination of these two entities, and TMA and ABOI, despite the heightened risk associated with this approach, including the potential for TMA recurrence and graft failure, patients' strong desire for transplantation and robust familial support prompted us for the strategic discussion between our nephrology team and the patient's family, and finally we went ahead with the transplant. So now coming to our patient details, recipient Mr. Raman Singh, blood group being B group, and elder sister sibling Mrs. Tinku Singh, only available donor with the blood group of A. After a comprehensive pre-transplant evaluation, including genetic and complement analysis, received appropriate pre-transplant medication, including rituximab for the recipient. The surgical procedure performed by our world-class experts of surgeons and anesthetists with meticulous attention to blood pressure control during this procedure to mitigate the risk of TMA recurrence was completely successful. However, the patient experienced a recurrence of TMA within hours of the transplantation post-procedure. promptly identified and treated through plasma exchange and rituximab administration. He responded to treatment and was discharged with a good urine output and good graft kidney function after 2 weeks of the hospital stay. So currently our patient is post-operative 2 months, doing extremely well with the normal graft function and a happy lifestyle and a healthy lifestyle. So I once again express my heartfelt gratitude to all the who are present here, and thank you for the patient hearing. Thank you very much.
Thank you, sir, for briefing about the case. Now I'd like to call upon stage our patient, that is the kidney recipient, Mr. Raman Singh, who is from Jharkhand, and his wife, Mrs. Shivani Singh, is an economics teacher at Patna. And his mother onto the stage. I request the recipient, Mr. Raman Singh, to share his experience.
Thank you. Am I audible? Yes. Yes. Okay. Thank you. So, welcome everyone, respected doctors, respected administrative, CEOs and CEOs, press, everyone, welcome. I'm so happy that you guys are here to listen to my story and our story and story of Virinchi Hospital and how good they're doing. So I'll try to keep it brief, but also try to keep it genuine. You've already heard from the doctors who have, taken care of me and taken care of my case. You must have already a good idea about how expert they are and how much they know about me, which even I don't know. But I'll tell you the story of a patient, or my story as a patient in terms of how otherwise a healthy person, 33, 34, having a very good life, not having any disease. Thank you, sir. Not having any disease, and having a very normal life. Never heard words like creatinine or renal or, these terms. Having a normal life. Suddenly starts experiencing, some symptoms which are very common to CKD, and started experiencing high blood pressure, goes to a doctor and hears this term called CKD. Like, okay, what is it? It's a chronic kidney disease. Well, I know there are a couple of kidneys in my body, but what about this disease? Well, it's a bad disease, it kills people, and it's a bad disease to have, but that's all I know. And then in January 2021, by some of the very good people and some of the very well-known people in my life, I have been sent to Hyderabad to a doctor called K.S. Nayak. And they say, look at your case, you should immediately go and meet one of the best in India and see what's this all about. Jan 2021, I come here, I meet my doctor, I have no idea who he is. I just know he's renowned as a nephrologist, but I at this point don't even know what nephrology is. So I am very good at what I do, but with no idea about this medical condition. Telugu is not my mother tongue, so I'll try to keep it in English only, but if anybody wants to listen to a Bhojpuri song, I can make you hear after this. That's my mother tongue. But anyways, coming back to the story is 3 years I have been in touch with Dr. Nayak. I have, in my personal and professional life, never met such a professional person who is so loving, a father like person, and very early in the process, he made me confident that he has exactly right idea about what my condition is and how it can be cured and what will be the phases I'll go through, and in every phase what should be our approach. So I'm otherwise, a patient who asks too many questions and is always like a little uncertain. So I make my doctor's life a little complicated, which is I ask a lot of questions, I make a lot of noises, and at every point I'll say, is this necessary? Which kind of makes my doctor's life not very easy. But Dr. Nayak and his team has been very patient with me throughout my journey. And very early in the process, he's made sure that you don't need dialysis. You can very well be taken care with medicines for a very good 5 years based on your condition, your lifestyle. And a time will come when you might need a transplant. So kind of make up your mind for it, but then we will be in touch. So you don't have to worry about it. That whole journey is the reason I did my transplant in this hospital. So I want to give like 99% of the credit to Dr. Nayak in terms of being such a busy doctor and such a big doctor. He still spends a lot of time with his patients and make sure that understand his patients' insecurities and try to address them one by one. And every member in his team has this quality, which I think he personally trains them. But somewhere in August, I came as my creatinine was somewhere around 8, and he said the time has come. We have been in touch, but you should now start looking for your donor. My sister, who was at this point ABO incompatible, I still, again, as I said, I have no idea what ABO incompatibility is, what TMA is. All I know is these are bad terms, and as not